Hey guys! Today we're going to go over how to treat an arrow wound, the do's and don'ts of a correct patient assessment. So let's go ahead and get started and see what Jackie's up to.
Stop! You're so stupid. I'm gonna shoot you. I swear to God. Get off! You're dead. You're dead. You're dead, cat. I shot an arrow in my foot because of you! It's in my foot. I have to call the ambulance. I have to call the police. I have to call somebody. I'm gonna die!
911, state your emergency.
There's an arrow in my foot.
An arrow in your foot?
You need to hurry up and get somebody here now.
Where are you located?
I live on 303 Chicken Coop Lane.
Okay, we've dispatched an ambulance.
Dude, seriously, I'm bleeding everywhere. There's blood everywhere. I'm gonna die.
Calm down and try to be patient.
I'll try to remain patient, but it's coming out so fast, I don't know what to do.
We'll be there as soon as possible.
BSI, scene safety. Scene is safe.
So let's rewind and take a look at that again. So here's Simon with his BSI, and he's checking to see if the scene is safe for him and his partners. Good job, Simon. And of course, this next clip is something that you shouldn't do on the scene. Alright, slowing down for just a second. First off, no BSI, no scene safety, and this guy in the hat, his name is George. You do not want to be like George.
Who's that guy?
I'm here too.
Where's the jump bag?
Oh, right.
So once you've cleared BSI, scene safety, MOI, NOI, number of patients, need for backup, and C-spine, you're ready to jump into AVPU.
Hello, ma'am. What exactly happened here today?
There's an arrow in my foot.
I can see that. How did you get to this situation?
Ask him.
Okay. Okay, ma'am. I'm going to ask you a couple of questions.
Okay.
Can you tell me what time of day it is?
It's nighttime.
It's nighttime. Can you tell me where you are?
I'm at my house.
Do you know who the president is?
Obama.
Obama? Okay.
Then for our ABCs.
I need Roma, if you could get onto breathing, and Chris, can you do circulation for me?
Pulse is strong and regular.
Ma'am, go check for your lung sounds.
Cap refill is 2 seconds.
Deep breath, please. Another one.
And skin is dry, pink, and warm.
Here's lung sounds for equal chest rise and fall. And then I'm going to put a non-breather mask.
So this patient's actually claustrophobic. Let's see how Romar deals with the situation.
What? A mask? I don't do masks. I'm very claustrophobic. I do not want a mask on my face.
It's your lucky day, you got an easel hand with you.
Alright, and that's how it's done. Awesome, Romar. George, on the other hand, not doing too well.
Alright, so I guess you need that non-rebreather mask, huh?
I don't want that.
Alright.
Okay, back to the serious stuff.
Okay, guys, we need to take the sock off.
Simon's got the right idea of cutting close away from the injury.
Okay, ma'am, we're just going to clean some of the blood off here, and then we're going to stabilize it and bandage it, okay?
Use bandages to stabilize the object. Good job. And then here comes George.
Well, haven't you guys pulled an arrow yet? Put it in there.
So back to the correct way on how to do the patient assessment.
Okay, guys, at this point, we need to load and go. I'm just assessing your pulse in your foot, okay? Can you wiggle your toes for me?
It hurts way too bad.
It hurts too much?
I can't move them.
You can't do that at all?
No.
Okay. Can you feel me pinching your large toe?
Barely.
Belly?
Yeah,
Okay. I need a full set of vitals. You can get started on that.
Sure thing.
Okay, ma'am. I'm just going to ask you a few questions. Are you allergic to any medications? No. Are you taking any medications?
Yes.
What are you taking?
Abilify, Celexa, Cymbalta.
When was the last time you had something to eat?
Lunchtime.
About lunchtime?
Maybe.
Okay. Can you tell me anything that led up to this injury?
I was pissed at my cat.
You were pissed at your cat?
Yeah.
Okay. The pain you're feeling in your foot, does anything provoke it? Does anything make it worse?
You know, maybe moving my foot.
Just moving the foot? Okay. What kind of pain is it?
Well, if you take an arrow and stab it into your foot, I'd say it's a stabbing pain.
Okay, thank you. And on a scale of 1 to 10, 10 being the most pain you've ever felt in your life, how would you rate your pain?
An 8.
An 8?
Yeah.
Okay, and how long ago did this happen?
About 15 minutes.
Okay, what did you find?
Okay, respiratory rate is 20, and then heart rate was 128.
Okay, and Romar?
Blood pressure is 120/76, and the skin is cool and pale, Captain.
Alright, that's it. Don't forget to reassess the patient every 5 minutes.
Cat, I'm trying to clean my bow. I can't take it when you're right here next to me.
That was awesome! Okay guys, at this point I can see that something like the arrow is our chief complaint right here. I'm going to ask you guys to, I'm not going to ask you guys, I'm going to do acting first. Okay, start over.
Come on, it's not going back. It's supposed to zoom out, but it's not.
I mean, it'll probably be easier.
Stop swearing in her video! I'm gonna have to bleep that all out.
Beep. Oh, push him out.
What do you do?
I had a turkey sandwich in here. This cat opened my turkey sandwich and started eating it. Okay.
I'm giving you a fair warning.
He's like, see ya.
Okay guys, it appears okay, you got
I don't have anything else.
Oh, that's silly cat.
I have check sticks in there. I have so
Just going to clean this up a little bit.
my foot! Go over
It's a
here.
freaking cat. Oh my god, did you get that?
The cat, Ninja Cat wants a sandwich.
Oh, thank you.
Are you gonna get the sandwich, Ninja Cat? Okay, yeah, but don't.
Can you out? Meow.
It is cool and pale, Captain.
Bingo.
Yay!
I have like covered and I'll be like, why didn't you guys pull the arrow yet?
Okay, here, look at Simon when you're saying that, and then just go for it. Oh my god!
That looks really good, doesn't it? Okay, how did you get to this situation? She's obviously a nutter.